All right, guys, what's going on? So I'm about to go through a squat session. So I'm gonna take you through what a solid lower body warm up looks like. A lot of you guys reach out to me, said, hey, how do I warm up for my leg day? How do I warm up for my squat day? So follow along here. I'm gonna take you through a series of exercises that I'm currently doing prior to all my squat sessions. All right, guys, so the first thing we're gonna get into, it's a 90-90 hip series. So we got our front leg and ankle at 90 degrees, our back leg and ankle at 90 degrees. We wanna go chest up, and I'm gonna start by just kind of doing an RDL motion, folding my chest over that front shin. We're opening up that external rotation on this front hip here. So I'm just gonna breathe, sink into the stretch, hold it for about 30 seconds, just getting the hips opened up, ready to squat. Next, I'm gonna get into internal rotation. I'm gonna drop my backhand behind me. I'm thinking about dropping my back butt cheek to the floor, rotating chest up, feeling that internal rotation stretch on this back hip. Now, internal rotation tends to be the limiting mobility factor that hinders people from hitting squat depth, so this is a big one. Now, I'm gonna add a dynamic component to this. I'm gonna do a knee lift off. So I'm pivoting off of the ball of my foot on my back foot, my chest is up, and I'm going through active external rotation. So lift the knee, pause, lower it down. Pivot off the back foot, lift the knee, lower it down, pause, trying to get a little bit more range of motion here every rep. I'm gonna hit 5 here. Now going into active internal rotation. So gonna pivot off the back knee and lift the back foot. Now this one is gonna be more challenging for most people. So lean forward a little bit, brace your core. Just try to lift that back foot as high as you can. Even if you're just budging it a centimeter off the ground, we're just actively working on those muscles that contribute to internal hip rotation. 5 reps there. Then we're gonna flip sides, take it from the top, back into that external rotation stretch. We'll hit this. We'll do the internal rotation stretch, and we'll do the knee lifts and the foot lifts, and then we'll move on to the next exercise. Okay, so now we've opened up the hips here. Now we're just gonna get the core firing. Nothing fancy here, just gonna go through a front plank, and then I'm gonna do a side plank. Now I'm gonna add a little wrinkle to the side plank and add kind of a side bend hip lift component to it, just getting a stretch through the whole oblique structure. Just your spine gets rigid when you've been sitting and sleeping, so adding kind of the side bend component, which you'll see momentarily, just helps get the whole spine moving in different planes. Just going 30 seconds in the front plank here. Now we're gonna go into that side plank with that hip lift. I'm gonna spend a total of 30 seconds on here. I'm gonna get 5 hip lifts. So side plank, then drop, hip to the floor, and lift. Big stretch across that bottom oblique and lift. Keeping that body in a good straight line. And then just holding for the side plank for the remaining time on the 30 seconds. All right, guys, so next I'm gonna go into a bird dog. If you're familiar with Dr. Stuart McGill, this is one of the McGill Big 3, a great exercise for the spine and just kind of coordinating unilateral movement. So on all fours, I like to go on my fists, opposite arm, opposite leg, kick that heel straight back. You go 10 each side. Okay, so the next series of exercises, I'm gonna be using a stability ball. So I'm gonna do groin squeeze, basically an isometric squeeze for the adductors, which is gonna help reset the hips. Then I'm gonna do an isometric hip bridge hold on the stability ball, which you'll see it's gonna get the hamstrings firing, the glutes activated. From there, we'll get some hamstring leg curls on the stability ball, get the knees warmed up, that whole posterior chain firing. So starting with the groin squeeze, stability ball between the knees. First rep, gentle squeeze, build pressure, 5-second hold. Repeat, a little more pressure. You might feel a little pop in the pelvis. I'm gonna get 5 reps here. By rep number 5, I wanna be squeezing like I'm trying to pop the ball. Next, going into that glute bridge hold. Let me get my clock here, 30 seconds. Legs at 90 degrees and up, actively squeezing the glutes. You'll feel this in the hamstrings, maintaining that 90-degree knee flexion, and of course the glutes, keeping the hips extended. Okay, from there, I'm gonna go into just a leg curl. So I'm gonna roll the ball out, legs are straight. I'm gonna hip bridge up, And curl my heels underneath. 10 reps there. And the final exercise of this ground series, I'm gonna do a single leg hip bridge march. So weight on the heels, hip bridge up. All that pressure on this glute, alternate. Squeezing the left glute, alternate. And get 6 reps on each. All right guys, so this is a squat session. Ankle mobility is key for squat mobility. Everything is initiated at that ankle. So dorsiflexion is something I want to get opened up here, which is why I'm going to do a deficit calf raise. I'm going to use a staircase. This is what I have available. If you're in a commercial gym, you can do this on a seated calf raise machine, a leg press, any machine that provides external resistance to kind of load that dorsiflexion. So I'm going to do a set of 15 on the calf raise, emphasizing a deep stretch at the bottom. Now, if you're somebody who deals with knee pain, these knee isometrics are going to be a great addition to do on your lower body day, especially before squatting. So I'm going to do 4 sets here. The first set is just going to be a body weight, a 30-second isometric hold at the bottom position of a rear foot elevated split squat, my back foot elevated on a bench. Then the second set, I'm going to do what's called an isodynamic rep, which I'll explain that as I get there. The third set, it's going to be slow eccentric reps. And then the fourth set, going to be fully dynamic, full down and up reps. Okay, so first set, I got my phone stopwatch. Drop into the bottom position, 30-second hold. Everything just locked in like a statue. Loading that front leg. Hit the other side, 30 seconds. Drop in. And hold. Okay, so the second set, we're gonna utilize what we call isodynamic reps. So I'm gonna get 6 total reps each side, alternating legs. Here's the kicker. Rep 1 starts with a 10-second pause, a 10-second isometric hold at the bottom. Right leg, left leg. Rep 2, 8-second pause. Rep 3, 6-second pause. Rep 4, 5-second pause. Rep 5, 4-second pause. Rep 6, 3-second pause. So we start with a 10-second, drop all the way down to a 3-second pause, 6 total reps each side. Let's stick with body weight on this. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And alternate. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then we're dropping 8 seconds. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 6 seconds. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 5 seconds. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 4 seconds. 4, 3, 2, 1. 4, 3, 2, 1. Last rep, 3-second hold. 3, 2, 1. 3, 2, 1. Set done. All right, so set number 3. Now there's gonna be no pause, but I'm gonna go with a 5-second slow eccentric. 5, 4, 3, 2, 1, up for 6 reps on each side. Now, depending on the severity of your knee pain, maybe you just stick with body weight, isometric only, the 30-second hold or a 20-second hold. Maybe you progress your way up into the more isodynamic, the slow eccentric, the dynamic reps. But I just want to show you a 4-step progression that can be very effective just for getting everything around the knee warmed up, firing, activated, and feeling good. Okay, slow eccentrics. I'm gonna add some weight now. Again, you can do this body weight. You can stick with just the isos, but I'm gonna go 5, 4, 3, 2, 1. Okay, switch sides. 4, 3, 2, 1, up. All right guys, so set number 4. Now I'm gonna go fully dynamic reps. No pauses, no tempos, dropping down and up through that full range of motion. Knees are feeling good. Now I'm gonna get things really firing with an emphasis on some good force production on the concentric. I'm gonna add some dumbbell weight. Again, you can go body weight. Maybe you just do the isos for all 4 sets. If you wanna do the full progression, dynamic reps here, 6 each side. All right, guys, so that's the warm up. Went through the ground series, the core, the stability ball, the hip 90-90, the calf, ankle mobility, did our isometrics, got our knees feeling good. So now I'm gonna throw the squat shoes on, the knee sleeves on, and actually kind of feel out the bottom of that squat position, start getting under the bar. So we're gonna get into that in a second here. Now, stick around. In a minute at the end of this video, I'm gonna add in a couple bonus exercises that can go a long way for making your knees feel good, alleviating some knee pain, and then just opening up some of that mobility around the knees, the quads, and the hip flexors. So stay tuned for the end of this video, a couple bonus exercises coming. All right, so squat warm-up is complete. So I'm gonna get under the bar here, start building up. Now, one little tip, I like using a mirror while I'm squatting. The mirror just lets me literally gauge my depth. So if I'm kind of favoring one side, I can correct back to center. If I'm seeing, oh, I'm high, I can drop down a little bit. Maybe I'm squatting too low, so I can just kind of correct myself back up into position. But the mirror is gonna give you instant visual feedback to help just kind of dial in your form. And I find it helps with balance. And if you're a beginner, it's a very helpful tool. So I've got nerve damage in my right leg. I've got poor kinesthetic awareness of that limb. So I still use the mirror to this day just to help keep me in the pocket of where I want to be technique-wise. Okay, guys, so the last exercise that we're going to focus on is a reverse Nordic. So you guys have probably seen what a Nordic leg curl is, right? Where you start falling forward, use your hamstrings to resist the eccentric. Well, a reverse Nordic is the opposite. Now we're going to get a big loaded stretch on the front of the knees, the quads, and the hip flexor. So I recommend you start with a regressed version. So we're gonna have a med ball between the feet, which is gonna shorten the range of motion as we fall backwards. Your butt's gonna hit that med ball. And then we're gonna have a band here, which is just gonna take some of the pressure off as we go down. Now, as you get better at these, you can get rid of the band, you can use less band tension, you can get rid of the ball to increase the range of motion, but I'm gonna show you how I'm currently doing them and how I recommend any beginner starts with them. So big thing is hips extended. So we got to stretch in the hip flexor, pull that band tight to the chest, lay back till your butt hits the ball, and then up. Big thing is, we're not breaking at the waist. Glutes are squeezed, hips are extended, lay back, big stretch in the quads and hip flexor, and up. Lay back, big stretch, and up. And as you go, you can roll this med ball further back, increase the range of motion. Again, you can get rid of the med ball, get rid of the band as you get better. I like to do a few sets of 5, going slow and controlled, kind of pausing in that stretch. Feels great on the knees, great on the hip flexors.